Chief Medical Officer Dr. Sharon Belmar-George indicates that it appears that the island is approaching the crest of the fifth wave of the pandemic. The CMO in the weekly epidemiological bulletin disclosed that the daily infection rate has dipped over the past 7 days.
As of January 23, 2022, St. Lucia has diagnosed a total of 19,680 cases in the country, with 4,233 active cases presently. The daily infection rate for the last 7 days is 164.4 per 100,000 population per day, which represents a 10% reduction from last week, with a 39% average testing positivity rate and a transmission rate of 3.1. We have noted a total of 318 COVID-19 deaths. We have 53 positive cases admitted at the respiratory hospital. 1 case is critically ill and 5 are severely ill. Since the commencement of the fifth wave on December 16, 2021, 6,551 cases have been diagnosed with an average of 172 cases per day.
Cases were on the upswing in the north and the south of St. Lucia, with the majority of the COVID-19 patients still being women, but the bulk of the deaths recorded among men. Although there is no forensic evidence, the Omicron variant sprints are suspected to be all over the recent surge. Despite the high numbers, the fifth wave is apparently reaching the plateau.
Women account for 59% of the COVID-19 cases. 22 COVID-19 deaths have been recorded, of which 59% of those are male. Tourists account for 2% of the cases diagnosed for the past 7 days. The prevalence increases are noted both in the northern and southern regions of the island. This week, although daily cases continue to be high, the 7-day average approximation suggests a leveling off, pointing to the plateau in the epidemiological curve. We are beginning to see reductions in some of the public health indicators. We have not received the gene sequencing results from the Caribbean Public Health Agency as yet, although we suspect the presence of the Omicron variant, which is characterized for the high level of transmission, and we still have the Delta variant in circulation locally.
But this silver lining is by no means a cause for complacency, given the potential for a rise in hospitalizations since the numbers are still elevated.
The high number of COVID-19 cases on a daily basis, as noted at this point, has the capacity to increase hospitalizations, deaths, and productivity in the workplace. We appeal to all organizations, public and private sector, to ensure the strengthening of all of the public health protocols. We remind you of the following important measures. Avoid large crowds and crowded areas. If you develop respiratory symptoms, seek medical care and avoid contact with others. Avoid large meetings, crowded activities, and social gatherings. Ensure the protocols are maintained at all workplaces and sectors, on minibuses and commercial and tourism sector, gyms, hardware stores, supermarkets, and recreational activities.
The CMO once again advised St. Lucians to ensure physical distancing at face-to-face meetings and activities. She implored citizens to wear face masks in public as well as practice proper sanitation at all business establishments and environments. Apart from beseeching persons impacted by COVID-19 to quarantine and isolate, Dr. George encouraged vaccination of employees and the public writ large, with vaccines available at wellness centers and advertised vaccination sites island-wide. Joachim Duplessis, HTS News Force.